Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalza.
I'm Dr. Brad Weenie.
Okay, we've made a video that talked about 2 foods you can ingest that can help lower your blood pressure. Okay, and there's really good evidence to support those 2 foods.
For sure.
It was beets,
the strongest.
flaxseed.
Yeah, beets and flaxseed. So those are number 1 and 2.
Yeah. Now we got a bunch of foods that there's some evidence, maybe not as good as a double-blinded, placebo-controlled, randomized controlled trial, but some evidence to support that these foods may, in fact, help lower your blood pressure and might work in some people.
Right, and for a bunch of very specific reasons. So probably the biggest reasons are potassium. So potassium is an important element that actually swaps out salt. So if you have too much salt, consuming a normal level of potassium pushes the salt out, and with it, it drags water. This lowers your blood pressure. Number 2 is magnesium, and magnesium has a relaxing effect on our vessels, as well as calcium has an effect on the smooth muscle that lines the walls of our vessels. So those big 3 are common themes in the foods that we're talking about.
And blood pressure is measured in millimeters of mercury, right? So you can measure pressure in things like pounds per square inch, kilopascals. In medicine, we use millimeters of mercury, and a manometer, or a U-tube, or U-shaped manometer,
U-tube.
There you go, is how you measure pressure in a lab, and it's millimeters of mercury is just one of the measures. However, in medicine, what do we use? Sphygmomanometer.
I thought that was the villain in either Stranger Things or the new Harry Potter.
No. Sphygmomanometer is what your doctor will use to measure your pressure.
Okay.
So a manometer, every time I say manometer, you should go do 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 do.
That's funny.
Manometer.
Manometer.
All right, that's how you measure blood
Sorry,
pressure.
younger people who don't get that reference.
Manometer, measure pressure. Sphygmomanometer is what the doctor's using on your arm with a cuff to measure pressure.
So we're gonna zip through the top 20 foods you can consider ingesting. Like always, discuss with your family doctor, particularly if you have blood pressure, high blood pressure, or any other medical condition, because some of them can aggravate, particularly kidney disease. That's probably the biggest one we're worried about.
Okay, and while you're listening to this list, try and guess the mammal that has one of the highest blood pressures. We'll tell you at the end.
Oh, I think I know the answer. Okay, so 1 and 2 we already did. Beetroot juice and garlic. So that goes, beetroot juice and flaxseed. Goes right into number 3.
Garlic has been, and that's decades old. I remember we had a substitute French teacher who smelled like garlic a lot, and because she had hypertension and she used to ingest a lot of garlic, kept the front 3 rows completely empty.
Right, and that's because of a component called allicin, and another component that they feel acts like an ACE inhibitor, which is a very common and commonly prescribed class of medications for hypertension. So garlic, so tastes good. And actually, I think there's another evidence that shows that if you take garlic, it actually reduces the amount of salt you require to make it taste better. So
keeps the vampires away.
Keeps it tasty. Number 4 is bananas. So bananas are full of potassium. Everybody knows this. All right, potassium gets bananas. So there's one study that showed if you have 2 bananas a day, that actually helped lower your blood pressure by 10%. If you have kidney disease, obviously you have to be careful of this. So anything on the renal diet has to be careful about potassium. But so potassium is number 4 in a banana.
Next, salmon and tuna.
Okay.
All right.
Why do they matter?
Salmon and tuna matter because they have omega-3s, and we've talked about omega-3s a billion times, but that can help too. And if you have high blood pressure, eating a lot of tuna, it's a great way to get a cool nickname. Hey, tuna.
Hey, big tuna. Hey, big tuna.
You coming with us tonight?
Okay. Number 6 is sweet potatoes. So they are a little bit sweet. They're not as sweet as you would think, like it's in the name. You think it should be really sweet, but actually they're very good, and they're an excellent source of potassium and magnesium, which we talked about have very specific effects on our blood vessels.
Beans, next is beans, mostly white beans, okay?
Yes.
So picture this, you're eating a lot of garlic and you're eating a lot of beans, you're gonna have no friends and no one's inviting you to any social gatherings anytime soon.
So the magical fruit, the more you eat, the more you lower your blood pressure. It's actually not as fun of a song to sing, but it does make a very big difference.
You'll be a real treat on an elevator with all that garlic and beans.
Number 8 is quinoa. Quinoa is an excellent source of fiber, potassium, and magnesium. It's one of those old ancient grains that is very, very good for you. Quinoa, number 8.
Kale, if you can gnaw through a leaf of kale, you might bring your blood pressure down.
Okay, and that's because of magnesium, potassium, fiber, and calcium, as well as vitamin K. But what I'll give you is a little piece of advice for those cooks out there. A lot of people say kale's hard, kale's bitter. You know how you get around that? You take a tiny little bit of olive oil, you dress it over top of your kale, and then you massage it inside of a bowl. It sounds really weird, but it makes a huge difference. So if you just take 30 to 60 seconds, massage each leaf with a tiny little bit of oil, it actually drastically changes the texture and the flavor of the kale. So there's a hot tip for you on how to tolerate kale, because kale is amazing for you.
Yeah.
Another green leafy vegetable, spinach. Spinach has all the same components: potassium, magnesium, vitamin C, iron, and vitamin K. spinach is very, very good for you. You can hide it in almost anything.
And we know Popeye never had hypertension.
No way. And look at the pipes on the guy.
Rip. Oatmeal.
Okay.
Eat your oatmeal.
Yep. Why does oatmeal matter?
Oatmeal, again, with the magnesium in it,
Yep.
got specific fiber that binds to cholesterol. We've already talked about cholesterol.
A lot about cholesterol. So next is dark chocolate. And it's actually not really dark chocolate, it's the cocoa and maybe even cocoa powder. You'd have to eat so much dark chocolate to lower your blood pressure, it wouldn't be healthy for you. So a little bit of dark cocoa in your coffee or in your smoothie or whatever can go a very, very long way.
Next is one of my favorite fruits, watermelon. I love watermelon. I can eat watermelon by the gallon. Watermelon has L-citrulline and L-arginine, which are precursors to nitrous oxide. Nitrous oxide is a very powerful vasodilator, which makes your vessels dilate. And you can imagine if you have flow through a pipe and you make the pipe wider, the pressure goes down. Same thing in the body. And nitrous oxide, nitro spray, sublingual nitro tabs. People with angina often carry that around to get rid of their chest pain because they can reduce their pressure and dilate their vessels.
Broccoli. Broccoli, similar to spinach and kale, has those 5 big elements that helps reduce blood pressure.
And can also be a cool nickname too, like tuna, right? Hey tuna, hey broccoli, you coming?
No one wants to call you broccoli.
Berries. How about berries? Eat berries. Berries can help lower your blood pressure. Some evidence to support the berries.
Absolutely. Because of those anthocyanins that we talked about before. Okay, fermented foods like sauerkraut, kimchi, and yogurt. So because of that good bacteria, it can restore good health, and this has been shown to reduce your blood pressure.
I'm running out. Is there cinnamon?
Yes, okay.
Cinnamon. Cinnamon's a good one too.
Okay.
Cinnamon's a nice spice to put on. Trials have shown cinnamon can bring down blood pressure in type 2 diabetics.
Yep, excellent. Extra virgin olive oil. So we talked about the healthy fats and the processing, the way that extra virgin olive oil is just pressed rather than heated, makes it a healthy way to reduce your blood pressure.
Walnuts.
Okay.
Walnuts with their omega-3. Again, omega-3 comes in just about everything. That can help reduce your blood pressure.
And there's a good study show that if you eat just half a cup a day, it helps reduce blood pressure in a reasonably good study. And the last one is pumpkin. So once a year, around Halloween, who doesn't like pumpkin? Pumpkin spice latte, pumpkin puree. It has an excellent source of potassium. This has been shown to reduce your blood pressure because it swaps out that sodium that we talked about before.
Trick or treat.
Wow, that is a long, complete list. It's not complete, actually. There's like hundreds of things that can help you, but these are 20 that have some evidence to show that they can help reduce your blood pressure in a safe, cost-effective way, potentially reducing your need for medication and allowing you to live a healthier, longer life.
Giraffe. Don't eat giraffe. No, giraffe is that mammal that has one of the highest blood pressures.
It makes sense because it's got to get all that blood up to its head.
Yeah, pressure can be as high as like 300 over 180 or something like that.
What happens though? It must have really good tight control because when it puts its head down to drink water, like how come it doesn't fall down every time?
Yeah, well, I guess it does have a good.
I think it has a good way to constrict it once it does
keep
that.
It down. Yeah, actually, because the pressure in a giraffe's head is around 120 over 80, but it's down around the heart where it's 300 to pump it.
Wow.
Because the pressure drops across that neck. By the way, 120 over 80 is our pressures that is supposed to be around.
Yes, unless you're giraffe-like.
Giraffe-like. Elephant, they have high blood pressure too.
They seem like they're high blood pressure.
All that tissue to get through.
The ears. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health and your own blood pressure.
We'll see you next time.